All right. Um, Good evening from Nigeria. I'd like to welcome everybody to yet another edition of OU Talks, the Ed series. This is an opportunity also for me to connect with old friends and colleagues. I'm glad to be here. So I'd like to welcome my colleagues and all the medical students that are joining us. And I hope you can pick one or two things, that can possibly change your life. So my name is Dr. Ayodeji Falana, and I'll be your host for tonight from Nigeria. And the speaker will be none other than let me get her name. Dr. Remi Okwechime. I hope I got it correctly. Who also graduated from OAU with me as well. So let me just give you a brief summary of what I do and how I've come from OAU so far. So I graduated in 2005 from OAU with Dr. Okwechime, and I had my internship there too as well. Shortly after, I had my youth service in Abuja at National Hospital Abuja. And when I came back to Lagos, I had a couple of stints in private hospitals. One of those hospitals I also worked with Dr. Ogundia as well for roughly a year. Afterwards, I joined the Lagos State Health Service Commission in 2009, and I've been there. I've risen through the ranks, and I presently work in Mainland Hospital, and I also double as the head of clinical medicine. On the other side, I work as a panel physician for the Australian Department of Immigration and Border Personnel. Yes, so things have been interesting. Since working in Mainland Hospital, we've had two major outbreaks. Let me put it that way. We had Ebola in 2014 and COVID in 2020. And I've served as a frontline worker, okay, in both cases. And we basically risked our lives. It was a scary period that time, but we thank God has kept us until now. And we've learned so much, in terms of, that center has also benefited, because eyes have been on that facility. And as I speak, next year, we would also, that place has already been approved to be a world-class center. So work is currently going on at that facility right now. Yes. Let me just do the honors of introducing our speaker for tonight, who is none other than Dr. Remi Okwechime. She's the Assistant Professor of Neurology, Neurosurgery and Medicine, University of Rochester Medical Center, Rochester, New York, USA. Okay, so let us give a brief summary of one moment, please. And read a brief summary. So, Dr. Remi Okwechime, MPH, is an Assistant Professor of Neurology, Neurosurgery and Medicine at the University of Rochester Medical Center, Rochester, New York, USA, the Neuromedicine ICU. She earned her medicine and surgery degree at the Obafemi Awolowo University, Ile-Ife, one of the premier universities in Nigeria, and completed her master's in public health degree with honors at the Grand Canyon University, Phoenix, Arizona, USA. She undertook her clinical internship training at the Obafemi Awolowo University Teaching Hospital Complex, Ile-Ife, Osun State, Nigeria, and her training in internal medicine at the Wyckoff Heights Medical Center in Brooklyn, New York, USA. She went on to complete her neurocritical care fellowship training at Ochsner Medical Center in New Orleans, Louisiana, USA. After completing her fellowship, Dr. Okwechime joined the neuromedicine ICU at the University of Rochester. She has special interest in neuropalliative research and care of the critically ill patients in the neuromedicine ICU, refractory status epilepticus in the critically ill patients, post-cardiac arrest care, and neuroprognostication, as well as brain death testing and organ donation after brain death. She loves to give oral presentations and she's an advocate for women's health in neurocritical care. So join in welcoming Dr. Remi Okwechime. You're welcome. So the floor is yours.
Hello, thank you so much, Deji. Appreciate that introduction. God bless you. Hello, everyone. Again, my name is Remi, and just an honor to be here today. Just to share a little bit of what I think has helped to I would say make me successful. I would say I was going to talk about three keys to success. A lot of people have many different keys. You could say like 7 keys to success, but I would just hone on three actual keys to success. First of all, when I graduated from medical school in Nigeria, 2005, September, I went on to do my house job at Ife as well, OAU Ife, the OAU Teaching Hospital. Finished that in 2006, August 2006. And after that, I went on to do my NYSC at Yaba. So it was Military Hospital, Yaba, Lagos. From September 2006, I did my, NYSC at the time. And then at that time, I also decided to kind of like, begin to prepare for the USMLE because I knew I wanted to go back to the United States. Having been privileged to have been, my family had been, here earlier on before. So I was like, I'm going to go back to the US. So when I came back to the US in 2007, started applying for residency. You know how it goes. I'm sure a lot of people have been through the residency process. When I started, I wasn't able to get in initially. I tried for the first time. I did my, applied. Then I did my boards, and then eventually I joined University of California, Irvine in California, in the neurosurgery department. So there I did research with them for about 3 years. From 2010 to 2013. At the same time, I was still applying for residency. At one point, I decided I wanted to do neurosurgery, and then I changed my mind. I was like, you know what, let's do something else. So I wanted to do neurology, and I was just like, all over the place. So at the end of the day, it was 2013 that I decided to do master's in public health. So I decided, okay, let me do public health. And then at that point, I really loved internal medicine, and I said, okay, maybe I should just do internal medicine. So I applied again, kept on applying. At this time, 2014, I joined University of California. I think it was Riverside, California, where I joined them, and I did infection control. And between 2014, 2015, I decided to go back to medical school. So I'm going to talk about these 3 keys to success. Now, the first key I'm going to be talking about is perseverance. So what is the meaning of perseverance? Now, perseverance means persistence in doing something despite your difficulty or delay in achieving success. So for instance, I particularly love this definition because it clearly states what I went through. I wanted to practice medicine in the United States. I had graduated from medical school, in 2005, and was applying for residency. But due to my extended, at this time, I was almost 10 years out of medical school. And at that point, I hadn't gotten into residency. So with all the things I've been doing, research assistant, temporary physician, project assistant, and most of these things were volunteer work, observership. And then 10 years out, I figured that if I hadn't gotten to residency at this point, I needed to do something different. It's just like if you keep doing the same thing and expect a different
Different
result.
results.
Crazy, right? So you have to do something different to get a better result. So I said, let me try to apply to school, to go back to school. So the first thought was maybe I should do physician assistant. So I tried applying. At this point I was in California. So I applied to the physician assistant school that was there in Riverside, California. But then I went to get my transcript evaluated. I got, prerequisites. They said you had to have 5 years, of your, you had to have graduated within 5 years. And I was 10 years out. And they said you needed your physics, your chemistry, and all that. And I said, what will I do with this? And I said, okay, let me get my transcript evaluated. I got it from the World Evaluation Services. I don't know if anyone has ever gotten their transcript evaluated. So I got that and had the MD there. Then I took it to this physician assistant school, and they were ready to, begin to transition me. And then they closed down. So the school closed down. So I was heartbroken. I was like, okay, I wanted to go to school. This closed down. What am I going to do? So the next step was, okay, I will apply for NP school, nurse practitioner. So I tried to apply for that one. It didn't work through. And then eventually I said, you know what? It was an uncle of mine who was an infectious disease doctor. And he said, if you don't give up, you should just, keep going, keep trying. Why don't you keep trying? And, you see, if you don't give up, you'll get what you're looking for. So I said, okay, let me try to apply to medical school. So at that point, I decided to apply to medical school. And I told myself, if I couldn't get into the medical school, I would do the DO school, the American DO school. So I applied to medical school and I was lucky. I was able to do interviews. I got it accepted and I started the medical school. So when I started the medical school, it was luckily for me, I didn't have to start again. They were able to take some of my transcripts that I had used. They said, okay, just do the rotations. So I did rotations in the United States. I did my rotations in Chicago. I did some rotations in New York. And then at that point, I started, applying for residency. Now, this perseverance that I'm going to be talking about is the fact that at the point when I had, kept on persistently applying, I had spoken to someone. Matt Dupree. Give me 1 second. So I had applied. So I spoke with one of my family medicine program directors who I had applied to, and this was in California. I was rotating with him, just doing, observership. And I said, I think said he would not take me into his department, even if I went back to medical school. So which brings me to my second key to success, which is persistence. So what does it mean to be persistent? It means that you are continuing in a course of action despite your opposition or difficulty. So my pursuit of medicine, despite the fact that someone told me that even if I went back to medical school, it would not change his, he would not change his decision to take me into his program, made me say, no matter what, I will still persist, So that's what persistence means. So I had gone in despite this fact that he said he wouldn't take me back. So a lot of people, you just have to keep pressing forward. No matter what, that the rewards will be there. You have to have patience, you have to have persistence. So I kept, pressing forward. Like I said, I did my rotations in New York. I was blessed and fortunate, I would say, that I was able to match. So 2016, I matched into the hospital for my internal medicine training at Wyckoff Heights Medical Center in Brooklyn, New York. And there I did my internal medicine training. So while I was doing that, I, during the residency, it was very difficult, I would say, because I was living in one state and I was commuting to another state. I lived in New Jersey and commuted to New York. It was about a 2.5 hour every trip. Actually, it was 1.5 hours for one trip and then 3 hours total. So I would take a bus and 2 trains to get to my residency. I would leave my house like 5 a.m. in the morning and get there for 7 a.m. because we resumed at 7 a.m. every day. So the bus was like 5:15, walk to the bus stop and take my bus and go on to work, and then come back sometimes around 10 p.m. and then, take a bus and get back home, the other state. So that brings me to the third, I would say the third key to success, which is resilience. So what does it mean to be resilient? Being resilient means the capacity to recover from difficulties. So despite the fact that I was, going through this 3-hour commute every day, I had a house, to take care of my family. I had to take care of, had kids, children, husband, and every extended family had to make sure everyone was well taken care of. I decided that I would go embark on fellowship. Now, fellowship was another ball game. Fellowship, I would work for 6 days a week, and I had only maybe 1 day off in the week for fellowship. And this was in New Orleans, and it was neurocritical care. So this one was driving 40 minutes one way over the longest bridge, I would say, over a continuous body of water in Louisiana. And over every day I would go back to work and say, I'm not coming back tomorrow. I was like, I'm going to quit. It was really tough. I would tell myself that, this is so stressful. I was the only one doing procedures for them. I was the only fellow in a 36-bed neuro ICU for 2 years. And I would do this every day. Sometimes I would not even be able to go back home. Maybe I'm driving home and they'll call me that someone had called off, and because I was the only fellow, I had to cover the shift. So I would go back and do the 24-hour shift. Usually it was the APPs, that's advanced care providers, advanced practice providers. They will call off duty and I would go back and call. Then, but I kept on, I would say, because of resilience. So looking back now over those 2 years, I'm glad that I kept on. None of the accomplishments that I've done so far would have been possible without, I would say, these 3 keys to success, perseverance, persistence, and resilience. And I wanted to share those examples from my life, just to encourage someone who may be facing an obstacle, or under, anything, if you're even giving up hope, just to know that there is one thing I can tell you, that for a career in medicine, you just have to have those 3 things. You have to. Do not give up. And if you don't give up, you definitely succeed. Like I mentioned earlier, my uncle who was an infectious disease specialist, he told me that in so many words, he said, don't give up. And he said he had also faced his own battles, his own giants. He told me of some of his friends who had given up, in the pursuit of residency, and eventually they were doing other things. You have to know what your goal is, really. If you decide that you want to go ahead with it, then you have to keep at it, perseverance, persistence, resilience. I think those are very important keys to success. And I wanted to share a little bit of what I'm doing right now. Like Dr. Ayodeji Falana told you, I am interested in, the care of the post-cardiac arrest patients who are brain dead or comatose. And this is just a little bit of a clip of what I do in my day-to-day work. And I'm just going to share my screen so you can take a look and see if it's, so the screen sharing, can you enable the screen sharing has been disabled.
Okay.
It should be enabled already now.
Okay. Okay. So this is going to be, make it bigger.
Okay.
So I don't think, I'm just wondering if you can see this slide.
Yes.
Okay.
Yes, we can.
So this is just a slide on brain death examination and evaluation of a comatose patient. So I'm just going to make this bigger. Okay, can you see it? And then I'm just going to press play.
In the evaluation of a comatose patient, you want to make sure the patient is not awake or breathing or insane or moving. I'm going to evaluate this patient. Oh God, can you do a spinal rub? Don, can you hear me? Not responding. So any response to pain, you check for periorbital pressure. There's no response to pain. Also make sure that it has no response to pain. That is toes. Make sure he's for pain. No response to pain. Check the other one as well. No response to pain either. You can also check for pain here. And then you click here. So keep the eyelids open and evaluate, see if there's any movement. So the eye should not move. The dull eye reflex should not be there.
So that's just a little bit of what the other things like corneal reflex and, you know, patients who has cough and gag reflexes, brain death, you know, how to examine a patient with brain death. This is a pediatric patient.
The evaluation of patient for brain death as examination for the patient, pediatric patient. Want to make sure that the age is greater than 37 weeks. Patients that are less than 37 weeks, you will not do a brain death testing on. Also, if you are performing the apnea test, you want to make sure that there are two different examiners who do the apnea test and two different documentation of the apnea testing. Make sure while you've done the examination, there's no brainstem reflexes, there's no routine, no cough, no gag, no sucking reflex, and the patient must be comatose. And the cause of the injury is known.
And then finally, just, you know, apnea tests, oculovascular testing, and then apnea testing. I'm not sure if you all have done apnea testing before, but if the patient is brain dead, usually we do the, when we're done with the regular examination, you have to do an apnea testing. And the apnea test pretty much should tell you if the patient is brain dead, then apnea test will be positive. So just wanted to share. I think this might be a 20-second video, and after that, I will stop sharing.
Evaluation of the patient who is comatose. When you're performing your apnea test, you have to make sure that your ABG has been done and make sure it's within normal range. When you're disconnecting from the ventilator. Of the respiratory therapist. The apnea test.
The apnea test, we're going to put the ventilator in standby. We're going to disconnect the patient from the ventilator. We're going to feed the suction tubing down the EP2 just to the EP2. We have the flow running into flow here at 6 liters a minute, and we found the veins.
So you wait for a minute. Once you've done your apnea test, you will testing for at least 6 minutes. And then within 8 minutes, you can check again your ABG. Once the ABG has been done, you compare with the previous one. And if it is greater than 20 above CO2, then you have a positive test. If it is 60 or CO2 is 60 and the patient does not take a breath, patient into the level of the thrombolysis. See if they're gonna keep breathing.
Okay, so that is. And that's pretty much just a little bit of what I do and what I've been doing for the past, I would say, a couple of years now. And I think I will stop at this point just to see if there are any questions.
There are a few questions in the chat for Deji and
Yes.
Remi.
Okay. Yes. Do you want me to read them out?
Yes, please. You carry on.
Okay. So Remi, this one is from Toby. Toby has a question. He said, please, does having a master's/PhD in neuroscience help getting into a neurosurgery residency program?
So
And how were you able to?
go ahead.
Okay. So he has a second question. Like, how were you able to combine neurology and neurosurgery?
Okay. So having a master's will give you, I assume it will give you an upper hand, but it's not a prerequisite. You don't have to have it to get into neurosurgery. To get into neurosurgery, you have to have, obviously you have research, you have to have a good ton of research, right? Like I said, I did research for 3 years. I think that will be helpful, to have papers, not just, doing the research, but have papers, publications. Those are very important as well. And then combining neurology, the question was combining neurosurgery and neurology.
Yes.
How did I combine both of them, correct? Okay, so I'm in the department of both, well, I'll say, because I did internal medicine, then I did neurocritical care. And then now I'm in neurosurgery and neurology because I have the background of medicine. So all 3 departments, I'm working in all 3. And I'm an assistant professor in all 3. So yes, I was able to combine it because I did fellowship, I would say. And my fellowship also comprised, like the neurosurgical aspect as well. But my main medicine, my main residency was internal medicine.
I hope that answers the question. Any more questions?
Does that answer your question?
I hope Toby is satisfied.
I'm not sure he's still in the meeting. I think a couple of people are having some connection issues.
Okay.
So I've had people bounce in and out for a bit now, so we'll just wait and see. Meanwhile, sorry, can I ask a question then on behalf of
Absolutely,
everybody
absolutely.
watching?
Yep.
I mean, it sounds like a huge thing to actually go back to medical school, like a huge thing. What was your major driving factor? What would you say? It's a big thing. You did it. I mean, we're all happy now, but I look at myself and I know, do I have such resilience? I doubt it. I don't think I'm that resilient to be able to take such a bold step again. What was the biggest driving factor for you?
I thank you for that question, Alaba. God bless you. So I'm going to be honest with you, okay? So when I was, that was like, I don't know, 6, 7 years, it's not even 6 years, 7 years, 7 years ago, I think. Yes, so I was talking to, it was my pastor's wife, and she had gone back to school because I think she did something like food and technology or something at home. And then she got here and saw other people doing pharmacy, and she went back to school and went to do pharmacy. So she went back to pharmacy school and she was loving it. So I spoke with her and I said, you know what, that I'm really considering maybe I should go back to school. She was like, doctor, she was like, you need to do it because the period you've been waiting at home, which was almost 10 years. She said someone would have graduated from high school, would have gone to medical school, would have done residency, and they would have come out and meet me where I was, and there would be no difference. She was just, no, it'd be different. So absolutely, because the person would be working and I would not be. So she said that, that's 10 years. You could have done something else with your life. And she said, why don't you try it? And I was like, I've spent 10 years already. Am I going to go back to school? I know a lot of my colleagues are like, are you crazy? But I said there was nothing, I didn't have any, like I told you, I wanted to do physician assistant, which was like 2 years. But then they closed the school and then NP didn't work out. So I was like, okay, this is it. And as God would have it, they were able to waive off those years, which was helpful, you know, and then I was able to, you know, year of graduation corrected, everything corrected. So it's like, okay, thank God. Yeah. Yep.
Thank you.
Does that answer your question?
Yes, mostly. Thank you.
Mostly.
It's remarkable.
Thank you.
Yes, it is.
It's remarkable.
And I told myself that if that didn't work, I would do DO school, which is 4 years. DO school, they will not waive anything for you. I have a colleague who finished in 1995, and he was with me. We were graduating the same year when we just finished, and he was finishing his own DO school, 4 years.
Oh,
So
DO school stands, sorry. DO school
DO
stands for what?
Doctor of Osteopathy. And they're also doctors, right?
Oh,
But
boy.
I don't know if it's even recognized out of the United States. You know what I mean? So I was
Okay.
like, I'm going to go to do this. I'm going to do something that is actually recognized somewhere else, you know? And then I was
Yeah.
like, okay, if it's MCAT, if whatever exam, you know, interviews, I was like, I'm doing all this just so that I can get something that's recognized, even if I decide to go to Nigeria, you know, not like it'd be like, what is DO? You know what I mean? Sounds good.
But I mean, I have to applaud your, you know, your doggedness and your resilience. Because it was like when you were narrating it, I was like, it was just one challenge after the other, you know. So it's, I don't know. I mean, that's
Absolutely.
even in, you can't even have it that hard in Nigeria. That's, I mean, there's no path that is that difficult, even down here in Nigeria.
Absolutely. And when the man told me
Yeah, because
if I go back to school, he wasn't going to take me, I was like, you know, they say one man's meat is another man's poison. So I was like, if you don't want to take me, I'm pretty sure there'll be someone that will take me, you know. I didn't tell my husband. I was like, if I tell my husband this, he's gonna be like, what are you going back to school for? You know, but I was
Wow.
like, I'm gonna still go ahead and try.
Wow.
And I think having a supportive family also plays, you know, a vital role in that as well.
Absolutely, absolutely. Yes.
Yeah.
Yes, I want to be very great. I'm very grateful that my husband the whole time he was supportive, because like I said, the only job I remember getting was maybe one that was paying $10 an hour. And this was like for 3 years. So I wouldn't say I was supporting the house at all. I wasn't supporting anyone. So pretty much my husband was very supportive, I would say. Yes.
It's amazing.
Yeah.
It's just amazing. Thank you.
Hello, can I
Yes, sir?
ask a question?
Absolutely.
Go ahead.
Anyway, I just want to state that Remi, this is Dele Okwala. It's so good to see you.
See you
Eji
too.
Falana. So good to see you.
Same here, bro.
Okay.
I'm not asking any questions. I just want to say it's so good to see you guys. Thank you for educating us.
Thank
Same
you.
here.
Thank you.
Thank you so much.
Yeah.
Thank you. Oh, wow. Okay. I mean,
Hi, Remi.
yeah. Hello.
Hi, Tayo. How
Hello.
are you? Good
Hello,
to see
yeah.
you.
I'm good. How are you?
I'm
It's
doing
such
great.
your story makes me take a deep breath and sigh. Like, oh my God, that has been a journey. And while I'd want to shift a little bit of focus to what other options, like you said, you considered being a PA, you
Yes,
considered being an NP.
yes.
For those who are not in, within the US, how can you describe how can you share with us the work descriptions of a PA, an NP, a DO, and what they do in the health sector, so that
Absolutely.
people can start to see how these people work together and where they can be in probably a clinic or in a hospital, what their role would be compared to now that you've gone to medical school and you've done residency and you have a fellowship, so that there's a bit of clarity. And also, what do you do from day to day? Because that question that Toby asked about neurology and neurosurgery, I'm sure in her mind or his mind, they're thinking neurosurgery, you go to the theater, you cut open
Yeah.
the brain and you
Right.
do surgery. Is that what you do?
Okay, good. So maybe I'll start with that one and I'll tell you what the other NPs and PAs do. So my day-to-day job, I wake up in the morning, go to work. Pretty much when I get to the ICU, I work in the critical care unit in the ICU, and that's my main job. So I work on patients who have gone to surgery, like neurosurgical patients, whether it's spine, whether it's brain surgery, whatever it is that they may have done, and I treat those patients. Maybe those patients have raised intracranial pressure and they are in dire need of, decompression, like, like one of my patients yesterday had to be taken, class A to the OR, but I'm not the one who does those OR. I don't do the actual, so I can do other things, like whether it's procedure like putting a borehole, in their head, but I don't do actual like cutting them open, relieving the blood or relieving the pressure, but I treat them medically. So I treat the neurosurgical patients medically. How's that? Treat them medically and then do some procedures on them. Yes, I do that. But actually working in the OR and doing those long 10-hour procedures, I opted not to do that. So I don't do that, but I do the critical care part. So intubating them, putting central lines, putting A lines, whatever it is that they need to be, whether it's EVDs or whatever they need just to relieve the pressure, I do those. Then that's the neurology part. Stroke patients, I deal with stroke patients. Maybe they had a stroke, they need TPA, which is, tenecteplase or alteplase, whatever you guys use in your hospitals, just to make sure that if the patient has a stroke, or if they need embolectomy, like the clot removal, to take the clot out. So when the neurosurgeons take the clot out, then I treat those patients medically when they come to the ICU. Then when patients are fine and stable, then I send them out to the medical floor. So the floor would take care of them. And pretty much if a patient, I also take care of post-cardiac arrest patients that, are seizing, patients who have whether it's, myasthenia gravis, whatever neurological, impairments may, whatever you can think of as spine, whether they have C-spine injuries, whether they have traumatic brain injuries, anything neurosurgical, anything brain related or spine related, I treat those ones, especially if they're having seizures or they're having, like I said, traumatic brain injury or head bleed or stroke, or even if they have like, whether it's, encephalitis or meningitis or something like that. So those are the ones that I take care of and I treat. Now, on a day-to-day basis, I work with physician assistants. I work with nurse practitioners. So the nurse practitioner has done nursing and then did a master's in nursing, and they're able to be a provider. So provider means that they can order medications, they can order things, they can also do procedures. So I teach nurse practitioners to do some of the procedures I do. They are able to get certified and do some of the procedures I'm doing. They work under me because they still come back to me and ask for, advice. Maybe they saw a patient and then we talk together as colleagues, then I sign their notes. So that's pretty much what they're doing. They're doing like what residents, so the APs and PP, should I say PAs and APPs, who are the NPs, they are like residents, but they're a different specialty. How's that? They're different background. So they don't have medicine as their background, but they have nursing. So they have nursing, but they have the masters in nursing. So they're a nurse practitioner. So those ones can do orders. Those ones can, because nurses cannot put in orders per se. Some of them can, but it has to be a verbal order, but they can't just independently decide that they want to do this or do procedures. So that's the difference between a nurse practitioner. Now, the physician assistant, some of them can also put in orders and some of them can also do those things that we're doing, procedure wise. But they did their physician assistant school, which is just 2 years. Their training is much shorter than the doctor, obviously in Nigeria, our school was 6+ years, 10 years for some, but their schooling is in 2 years, they cram everything, but they still have some knowledge deficit, obviously. So they come to us and we are the ones who sign their notes and, tell them what to do. And then they go, it helps you, especially when you have many patients. Like if you have like 30 patients on your list and you have some APPs who can write those notes, that's really helpful. So that's what we use them as, just like we use residents, like we have residents, I have residents, I have fellows, and then APPs and NPs. So they kind of do the same job, but they're all supporting the team with the physician as the head of the team. How does that answer your question?
It does. It makes it clearer. And I know the US system is super specialized, where you have all those different roles. It doesn't apply like that in Nigeria. That you can, as a host, he can speak better to that. So it helps to understand how they got into those roles and the fact that there are options, because a lot of people look at migrating and saying, you just want to hop over to the next country and you think you could just get a spot in residency as easy as that. Your story tells of the times when it doesn't really work, where you have to seek other options that are not in core medicine. You persevered and you went that route. It took you longer, but you are where you are today. But there are options. The PA option, I wanted other people to also learn about that, because that's an option to work in the medical field with your foreign degree. But however, if you're back in Nigeria and you finished, apart from residency, I think it's just being a medical officer, right?
Absolutely, yes. Yeah. Yes. You're a medical officer, and you can also specialize back home too. You can specialize back home.
Right. I was going to ask if Deji could speak to that. Yes. Or okay, Dele is here. Hi.
Yeah, and I'm very glad that you brought up what you just the question that you just raised to Remi. I'm sorry I lost my voice, but very good question and very good way of enlightening these young ones. Since we started this stuff, I've had the privilege of mentoring a lot of these young ones. In Nigeria, I think, like I told you during the other time we met, we don't have a lot of, maybe our eyes are not opened to the other opportunities that are available other than the clinical, the bedside medicine that we all practice in Nigeria. But when you come to a state like the US, for instance, where there is a lot of opportunities, in fact, there's way more opportunities outside of the clinical medicine than the clinical aspect that we all know of. And let them know that, you don't, if you don't have that flair to do the clinical aspect, you can as well open up your mind to what is available outside. The US is huge. The healthcare system here is so big that it accommodates you. Just having that MBCHB or whatever we get in Nigeria or MD, you're already on top of achieving so much coming into this system. You have pharmaceuticals that can hire you. You have the IT, you have, so many other things, not even the nurse practitioner, because, there's so much you can do, and you can be the head of hospitals. And, there's just so much you can do in healthcare here in the US, and your eyes has to be opened to all these other opportunities that are available out there. So, if you're someone like Remi that tried and you just don't want to go back to medical school, there's just a lot of opportunities out there that you can benefit from. And many of our colleagues are in all these positions here and there. And if you don't ask, you won't know. It's great to be able to go to, back to med school, and it's a huge story. It's a big success story. But just like Alaba, I don't think I have such patience that Remi has to go back to medical school. I keep telling people that one of the worst things that would happen to me would be to go back to med school, because I did not enjoy it. 10 years, geez, even though it's gonna be like 4 years here in the States, I don't think I ever want to go back. I would rather do something else. Anyway, good question, good discussion. I really enjoy what you guys are doing, Tayo, Alaba. Thank you, Deji. Thank you, Remi. It's really good seeing you guys after such a long time. I'm so excited to see you guys here. Thank you.
Thank you so much.
Thank you so much, Dile.
Thank you,
Somebody-
Badili. Elena Tom.
No, this
Yeah.
Somebody asked in the chat, they said, is associate professor the same as the assistant professor? No, they're different. So the associate professor is one step higher than the assistant professor.
And what do you require to move from assistant to associate?
Really, it's just time. So when you start, it takes, I think, a few years, and then you just, you have to have all your ducks in a row. You have to have this, there are many things that you have to fulfill. And once you fulfill those requirements, then you should just go for it. Yep.
Can we also give a little perspective to those who are not planning to relocate? They're not planning to, and we're not saying people should jump the hoop and relocate. So let's make that clear. We're saying people in Nigeria who want to practice neurology or neurosurgery. Do you have any idea of what they need to do?
So I remember one of my colleagues did neurology in Nigeria. Yeah, we have very few in Nigeria, I would say, and I think it's something that we should encourage people to go into, especially neurology. Even if they go into neurosurgery, that's great, but there are very few neurologists in Nigeria. I remember even my mother-in-law told me that her husband had to come, go to maybe London or something just to find a neurologist. So I think it's something that we should recommend that they pursue. And I know we can do it even in Ife. In Ife, we have neurology, training residency, so we can encourage people to go in, and become neurologists. I know some of our colleagues who did neurology in Ife.
There's another question in there.
It's from Toby too as well.
What is the easiest pathway to entering a neurosurgery fellowship as an IMG? Okay, perfect. So as an IMG, I think that when you finish your residency, they look at all these things. They look at scores. Apparently, they look at, year of graduation. And if you're doing something, you have to be doing something. So even if you had a year of graduation that is a little bit far out, but you have to be doing something. Like I remember I got like 3 interviews for neurosurgery, but I decided not to go that route because it was like 7 years. I was like, I don't think I want to do 7 years on top of everything I was already doing. I was like, this is too much, but I'm telling you that you need so what were they looking for? They're looking for research. So I had research in neurosurgery. They like bench research, the ones that you go with lab rats. So if you have an opportunity to do that, be helpful, like with universities, in the setting where they do actual, when I mean bench research, I mean like, the laboratory research where they work on, whether they're working on rats. Like my research was on tumors, brain tumors in rats. So we're trying to see like glioblastomas, IDH1 mutation, 1p19q deletion in patients, to see which one had a good prognosis, especially oligodendrogliomas, glioblastomas, GBMs, brain tumors. So we're injecting the rats with the brain tumors and seeing how, you developed stuff like that. So those are things that in your interviews for neurosurgery, you want to have something to talk about the research you're doing. So research, they're big on research. So I would say if you are an IMG, obviously your best bet would be to make sure that you can do, if you do rotation with them, that would be nice. If you can do rotation, if not, try to get research and get publications, I would say. Yes. Okay, somebody said he trained in yeah, so I did trained as a neurologist.
Ayodeji.
Right.
Yes.
Right, so you can help people to guide them into neurotraining, absolutely. Yes, then they said, somebody said research, for the research will be the option of pursuing a master's in clinical neuroscience. Yeah, absolutely. I think just looking, and people always are looking for someone to do research. Like I have a medical student who wants to do neurology and he's asking me, if you can help him with research. Absolutely, I would take anyone that wants to do research, like in a heartbeat. So we have lots of research opportunities. So if you want to do research with me, all we need is just someone who's willing to work. That's it. So absolutely, and then you can get letters of recommendation, because we look at those things when we want to admit them into the medical school. We look at letters of recommendation, whether they're, if they really like the person, so if you are working with the person long enough, like at least over a month, then they can give you good letters of recommendation, and then you can start applying,
Do you offer attachments, clinical attachments? Let's say someone who has a question, Toby, for example, wants to spend a month with you in your department. Is that something you could facilitate?
Absolutely, absolutely, yes.
Because that would be quite helpful for their CVs.
Yes, absolutely, yes. We take clinical observers from outside. Yes, we do.
Okay,
yes.
Thank you.
Any more questions?
This is not a question, but just want to say, Remi, thank you so much for sharing your story. Not so many people will be bold to come out and say they went back to medical school. We'll have just met at reunion and we'll think, oh, Remi's an assistant professor, and hey, hunky dory. But thank you so much for sharing your story, for being an inspiration, and for being an inspiration and helping people see that if you believe in something, irrespective of the odds, you just need to stick to it and keep on going. Like Alaba said, hey, your level of resilience is on another level. Sincerely, I wouldn't have even thought about it twice. As in, just forget it. I wouldn't even think about it. But thank you. And I think the message for most people here is that irrespective of what we want to do, right, there'll definitely be obstacles on the way, and we should just keep that as focus and keep going at it, and there'll be light at the end of the tunnel at the end of the day. So thank you so much, Remi.
Thank you, Muyiwa. God bless you. Thank you. I appreciate that. And honestly, I think that I would just say that it wasn't as if I had thought from the beginning that I was going to go to school, but just because, like I told you, my pastor's wife said, this one that you're just sitting at home, why don't you do something with your life? And I was like, you know what, that's true. So I think that was helpful. It's good to have mentors. I think having mentors is very important. You have to have mentors, because you by yourself, obviously it takes a village to raise a child. So you need someone to tell you that, I think that you have to have this goal and go ahead and, pursue that goal. And it's good to continue mentorship. So even you as an adult, you should have mentees. So that's what my goal is, have mentees and continue mentorship with other people. That way you can grow your mentorship cycle and teach. See, my goal, my slogan is see one, do one, teach one.
Teach one.
So you see one, do one, teach one. Okay.
Yes.
It's beautiful.
Yeah.
Any other questions?
Remi, thank you so much for the insight you share and your resilience and perseverance in achieving what you had at the back of your mind. So if I wasn't your shoe, I'm sure I'll be a farmer by now. But, on the neuro aspect,
yes.
I know a friend of mine, a colleague, a former colleague, were both in residency for family medicine before he dropped out of residency, went into lecturing. Now he's into neuro research in United States, and he told me that opportunities abound when it comes to neurology or neuro research generally in United States. I think he's into neurophysiology / dementia or something like that.
Yes, absolutely.
Yeah, I just think I'm not going into that. Just for the people coming behind us, even a couple of our classmates, some of them might be interested. I think it would just be nice to just drop on the class blog, just drop some links that can be shared in which people can apply or just look at and see which one suits what they are looking for.
Right.
Thank you. Deji.
Yes, Afo.
Yeah, doing well. You are doing well. You are doing well. Only you,
Thank you.
only you, Ebola virus. You are just like Donald Trump. Now, COVID enter his body, but just look at Donald Trump. I'm in the wrong body. You are doing a good job. Thank you for holding. Thank you for holding Yaba very well. Thank you.
Thank you very much. Okay.
Nice job, man.
So, I mean, I could just, for the website, I would just say we are also doing like Parkinson's research, different things. So it's just the website, I'm going to say, so they can look at it and see if there's anything that interests them, they can go ahead. I'm just putting it in the chat. Okay.
Okay.
It's just a general website for the university.
Or it can also be attached. It can also be attached to the YouTube video that we later uploaded.
Okay. Okay.
Those links will be also added to as well.
Yeah. I put it on the chat.
Okay. Okay. Abba has confirmed that will be done. Any other additions?
No subtraction.
No,
Multiplication.
sorry, Deji.
Yes.
Deji.
Yes.
Please.
I can hear your phone.
Is there any opportunities for observership in your area for the med students?
Oh, yeah, we used to have that. Like we have people who come and rotate, okay, but it also has to be sanctioned by the Health Service Commission. So you can't just come, directly, okay? It has to be an official, you have to go through a process. Okay, the government has to be aware, okay, that you want to do something with us, especially if it's for research purposes or anything. So that's how we've been doing things. Like anybody is free to come, okay? But the government has to be made aware because there are attendance risks, So it's possible. Okay, we have people who come around, especially when remuneration is not involved, they're working. Yeah, so I mean, government is, yeah. So I mean, once you're not asking for money and you observe all infection prevention and control protocols, we have no issues to pass through, the Health Service Commission and and you can learn.
Okay, but
you can learn a lot.
Most definitely, guys that are interested in infectious disease can definitely contact you.
Yeah, okay, let me put it this way. And for reasons best known to them, okay, we've learned from Ebola, from COVID, people are usually interested in the research aspect and we've written like lots of papers, since Ebola and COVID struck. People are usually interested in that aspect, but clinical aspects, people actually run away from that because of the risk that is involved, because of the risk that is involved. That's why the fact that Mainland Hospital has like probably the best infection prevention and control protocols and measures, in the whole of the states. Okay, so people are actually, scared. It's the same, I think it's the same story in Ebola and in Delta states, you understand? Where you've had cases of, personnel coming down with Lassa fever, or getting infected with Ebola. But Lassa fever, there's a time Lassa fever almost wiped out their workforce. So people are not keen, they're just like there for a short time. They're not keen at, working there, doing something there for a very, very long time. So it's common to see people just come, spend a couple of years, and go, okay? So usually what we see is people have transitioned from actual clinical work to, the programmatic aspects, of infectious disease, writing programs, monitoring tools. They're interested more in the, the administrative and public aspects of infectious diseases as opposed to like, getting involved proper. So that's the pattern we have seen. You're not going to find lots of doctors working, clinicians working with infectious disease. Everybody says that's where the money is. Okay, so it's people who work on the fringes that actually make the money, not the people who get their hands dirty.
And
That's
for
the
just
summary.
not to interrupt you, Dr. Falana,
Yes.
for those who don't know, Dr. Falana is the big shot in infectious diseases in Nigeria. If you remember the COVID season, this was the man behind the scenes that was helping Lagos State control the whole of the COVID centers. And we are expecting him to speak in 2023. He's still trying to find time, you know, for us to get this time with him. It took quite a bit, but he's trying to find time to speak about it. So for those who are interested in infectious diseases, management, execution, operations, networking with, you know, the big shots, you would want to look out for that episode with Dr. Falana in 2023. Just want to put that in before we wrap up.
Thank you very much. It didn't take time. All I had to do was just to
Why
call
did
me.
it now? We are setting
I
the
just
time.
had to convince me. It was a 5-day call. I didn't have to do
We
much.
knew how to get in. We knew where to squeeze.
Exactly.
I just called and convinced me. You know, I'm a chess master, so it didn't take much.
You know the job.
I'll be glad to share, you know, my experience in the near future and
That was so good.
and see how. Yeah, but what we've just seen is there's a lot of staff attrition. A lot of people are running away. You know, even in my facility,
From you?
like 6 people are leaving. Yes, I've been signing resignation letters. You know, like a lot of resignation letters in the last 2 months. So everybody's leaving. Yeah.
My first close encounter with a COVID patient in 2021. I was just in a room and the result came out that the woman was positive.
Oh yeah, I remember that.
The evening of that day, I had all the symptoms of COVID. The only person I could call that night was the Falana.
But I think
Guys,
I just had to put the control because.
Guys, can we round up the meeting so that we can then have
Yes.
meeting meetings? Thank you.
Okay. So want to thank you know, Dr. Remi Okwechime once again for that wonderful, truly inspiring story. In fact, what was going through my mind was what she's gone through. You can actually, like, you know, produce a documentary or make a film about it, because I was wondering what was going on. Like, it was one obstacle after the other, and she was surmounting those obstacles. So please, would like to thank Remi. You're truly inspiring. That's what I have to say. You're a very, very strong woman, and we thank God for, you know, your resilience and your doggedness. And remember, for the medical students out there, you need a good support system too as well. So, like you said, you need mentors. You need people, you know, in your corner that will encourage you, you know, that won't discourage you. And like Remi said, somebody told her to her face that, you know, even if he, you know, went another route, he wasn't going to, you know, entertain her or support her dreams. So, you know, just follow your dreams and make sure you have people in your corner advising you and supporting you. Okay. Of course, like what Dele said too as well, sometimes if one door closes, okay, the other doors are open, and you can also explore options. You know, it doesn't have to be rigid, you know, the specialty of your choice. And sometimes you might just consider other options, okay, because the world of medicine is so wide, and, you know, it can never be saturated. There's always room for more people, more professionals, and, you know, what have you. So I want to thank everybody for joining. We're like 9 minutes above time. I'd like to thank Alaba and Tayo, okay, for convincing me to take this on top notice. It's good to reconnect with people like Dele. Ohake, I see you. I think some other classmates who jumped in. So it's lovely to reconnect with everybody. You know, and I look forward to, you know, more webinars like this. So thank you very much. Thank you to the medical students for tuning in too as well. Yes. So good night and God bless.
Thank you for having me.
Bye, everyone.
Yeah.